Okay. Okay. All right. Hi, my name is Bianca Pearson, and thank you guys so much for standing and staying after to be able to listen to my presentation. So we're going to talk about, is it ethical to use AI in healthcare for the greater of good? So the AI tool that we're going to be talking about is the Alt AI for assessing the AI-based technology responses that we get from an AI response team. So the use of AI in healthcare setting is on the horizon. Shapes is trying to test and pilot and determine if this is going to be put into everyday use. The AI has a self-evaluation tool for giving out recommendations that will be provided for providers to analyze. And this was on a scale of non-existing to fully adequate, depending on what the response they get. So the goal of the pilot is to show that the system has enough reliability to be used in care with a healthcare provider. The systems will mostly be used in assisting clinical diagnosis, improved decision making, and remote monitoring of patients. So this is the scale that we go off of for Shapes. So Shapes is for legality, ethics, privacy, and the fundamentals of rights protection. So the AI Alt tool is assessing the framework of the system that's being used, the Alt AI assessment, and then the recommendations that are given after. So the next part is recruitment. So this is for the members who are going to be a part of the pilot, whether that be the healthcare physicians or the patients. So based off of that, we have a data collection of literature review, the Alt AI self-assessment that is reviewed after, and the online workshops that we get from the pilot results. So this transfers into the data analysis, which is validated by other sources, and then we get a lessons learned about the Alt AI that is used, and we draw a conclusion. So this is what it will show, and it'll give you different types of care, whether it be digital, like remote, or if it's in-person care. So what are ethics? Ethics are a standard of right and wrong that influence the decisions of behavior, and this is for right or wrong of in a society. These are typical things that are found that are not ethical in a business, and they're these 6 different categories, which is conflicts of interest, abusive behaviors, violations of health and safety regulations, corruption, discrimination, and sexual harassment. So why would we choose Alt AI? So it's been tested by healthcare providers, and the response was overall positive in improving the work productivity. So this system keeps the sensitive data protected and accessible. And it would also serve over 135 million patients over the age of 65. The use of these systems will allow the providers to spend more time present face-to-face at these appointments. And over time, it would save costs for labor and excessive testing in hospitals. So is this the right choice? Hospital leadership will have to determine if this is an ethical use of technology. The use of this would create a dilemma, and some may find that it's a great thing, or some may find that it's a bad thing because it's too much technology. But uploading patient information puts it at a high risk of being breached, and there's nothing that you can do about information that's being leaked after it happens. So a notable point to talk about is that all medical documents are online anyways and at a risk of being breached. So this is nothing that's new. And the use of a collective database in patient care is not new. Doctors will reference online sources to ensure the diagnosis and treatment is correct. So they actually have their own Dr. Google that they will double check things on. So concepts that we want to highlight are that the company needs to withhold a social responsibility when using this. So this is monitoring and controlling the ethical misconduct that is a concern of the AI system. So as long as they're being monitored, it should be fine. And this approach would be meaning that is for the greater good. So the conclusion is the unethical misconduct of concern when putting all of this information in the online database and doubtfulness, and the providers giving thoughtful care. So the breach of data and corruption within the use of AI is prevalent, but again, the files are already online and at risk. The Alt AI system self-check for patient outputs gives a list of recommendations for the healthcare provider to reference, and over time, the process will become more efficient, costing the hospital less money, and doctors will have better time spent with patients. And I do see this being useful in healthcare as it will provide better care for future patients.
Awesome.
I have to show you guys.
Oh, okay.
I have to show you guys now.
Yay.